I'm Nalini Madhavan. I'm 69 years. I'm from Chennai. I have for the last maybe 10-12 years I've been practicing Kriya Yoga. So I was keeping very good health. There was no signs or no premonition that I would be falling sick. The only thing was I was not able to go for my walks and I thought I'm putting on weight because of that. I did not realize that it was the buildup of ascites, which is one of the symptoms of ovarian cancer. Until one day I just started throwing up. I could not eat anything. So we called our family doctor, and the nurse who came and examined me told me there is something, you're having some gynec problem and you please get yourself checked. That was how we first went to get tests done. The CT scan and the PET scan showed there was a problem, and that's how I was first diagnosed with ovarian cancer. It was a stage 3 cancer where the CA-125 levels had really gone up to 3000. So the doctors were a little worried because of my age also. But the treatment started within a week. This started in Chennai.
Initially, when the first diagnosis, it was a bit of a shock because she had never fallen sick. Now, in our 4.5 decades of wedded life, she was admitted only twice, once for delivery and once when she met with an accident. So, when this diagnosis was brought out of the blue, but then we are quite sure that we will somehow weather it over because we trusted modern science, we trusted the doctors.
And I was given 6 chemos. I responded quite well. Only thing is, when I was taken for surgery, they did not do the surgery there. They said they were not able to do, it was against their protocol.
I was there waiting outside the theatre. So the surgeon came out and called me after 1.5 hours, me and my son, saying that we are not going ahead with the surgery because the outside walls of entire small and large intestines are full of minute tumors, and it is against our protocol to cut them because we can damage anything. So we would advise you to take 2 more chemos, and then after maybe another 8 weeks we will try once more surgery. And then when I asked, at least do the hysterectomy, remove the ovarian, uterus and all other, the source of the cancer. So the rest of the things we can again follow up. They said no, that is not the protocol. Either it's all or none. So we advise you, again we come and meet the tumor board and then we will take it forward. Personally, I was not very keen in following up that because a cancer cells which did not die in 6 chemos is not going to die in next two more chemos. And then I was worried whether we may waste another 3 months in this treatment and find that still the cancer is growing. So then when my nephew told me, Mama, would you like to meet Ajaikumar? I said yes. What impressed me the most was, he was saying, see, I was trained at MD Anderson. And 50 years of oncology, we have seen enormous complications. This is not an issue. So you come here, we will handle this surgery. And then when I told him about logistics problem, he made one very cryptic statement which I will never forget. He said, cancer is not a disease of convenience. You have to make it happen to treat it. Then the surgery, after all the tests, etc., the surgery took 12.5 hours. Dr. Abhilasha, the gynec surgeon who handled, she called me and briefed about the whole surgery that they had taken. So she said, completely the small and large intestines outside walls we have shaved off. Whatever we could see, even from the lymph nodes, etc., anything, whatever we could see, we have completely removed. Now Dr. Prabhu is doing the with the rectum, and then he will do a HIPEC treatment. He was a GI surgeon, and he came and shook hands and he told me the surgery is over, she is doing fine. Then I said, how she is? She said, it is fantastic. The entire 13 hours on the table, her BP was 110/70. She has no comorbidities, so I am very sure she will come out well. So all this, such wonderful personal vibes, the positivity, the treatment, the skill sets with the technology, the research, the medication were absolutely, we can't ask for more. We'll be greedy if we ask for more. After this, 2 weeks came back for remove the suture, etc. Then we again met Dr. Ajaikumar and he said, I am extremely pleased. But even before the surgery, he told the kind it has spread. I mean, we will try to limit it during surgery, but still there will be a disease left over. That's a second treatment, second line of treatment that we will not bother now. We'll take it up at that point of time. So after the surgery was done, after 6 weeks, he said we will do the, they had put a stoma bag, and the reversal of stoma we will do, and then we will investigate. So when we came for the stoma reversal, the CA 125, which had come down to 102, again had climbed up to 375. So he was a little worried, and he told me over phone when I was in Chennai, Madhavan, how quickly you can come back? Then I said, why? I said, I don't want you to lose the benefit of surgery. If it goes beyond 1000, again we lose the entire benefit of surgery. Somebody will come and pick you from the airport. They'll straight away bring you to the hospital. Tomorrow morning we'll start the procedure. So exactly they had arranged, reversal was done. Within a week they started the next level of chemo. Then after one cycle again when they tested, still it was going up. Then he ordered for a special MRI at the hospital cost. He told me that I will do it at my cost, you don't worry. I told him I am not worried about cost, I am worried about, he says, no, this is about a doctor's ethics. You don't worry, we will take care. So with that kind of treatment, the CA 125 has come down to now around 60. So in the next couple of cycles, he feels that she will be normal.
First of all, I would like to thank the ICU staff. After the surgery, the initial surgery which took more than 12 hours, the 3 days in ICU, the care that was given was exceptional. I have never seen such dedicated staff. It was like, they were so close. I became very close with them in those 3 days. Because when you see a doctor so confident and able to do, and when you have come from a place where they said that they cannot do the surgery, it stays with you. Then I would like to talk about Dr. Prabhu. Such a vibrant person, always sending out positivity. And when he came, you felt that, of course, he said this can recur and all that. I mean, he didn't say that but the way he used to interact gave a lot of confidence that here I'm well looked after.
I would like to tell a little about Dr. Ajaikumar. 3 to 4 sittings, close sittings we had with him, each time lasting 30 to 45 minutes. He never looked at the clock. He never looked at anyone. He was directly addressing her and me. He told me, she's just like my sister. You don't worry, I will take care of her. I told him, I know doctor, she is in safe hands. So what I wanted to say is, it is not the skill sets. It is the emotional empathy and one with the patient that gives tremendous confidence to the patient and also their supporters. So that way he stood apart from other doctors whom we have met. So this kind of vibes and positivity with a multidisciplinary is very rare to find. So that shows how the hospital has groomed a whole homogeneous team to treat the patients. So we are very, very thankful.
I would like to go back to whatever I was doing earlier. I was doing all the cooking at home myself without any help. I would like to do that and relieve my son and husband.